The next topic we're going to talk about is something called endometriosis, because Endometriosis Awareness Week is upcoming. And I'm sure in the comments we'll put a link to a blog post we have on our website, which is really informative about endometriosis. So, please do have a look at that if it's something you suffer with or think you might suffer with. So what is endometriosis? So it's a condition that affects women because what it is deposits of what is the normal womb lining occurring outside of the womb. So commonly it's on things like your ovaries or the tubes between your womb and your ovaries, but it can be on bits of the bowel and gut and other organs that are nearby. And again, this can lead to having pelvic pain in the pelvis. It can lead to heavier bleeding. It can lead to irregular bleeding, and it can be a cause of contributing towards infertility. So it's quite significant. It's going to be disrupting your daily life and or maybe your plans for building a family. So how does losing weight have an effect on endometriosis? Well, there's a couple of things to consider when we're talking about this. So what we know is that when those areas of the uterine deposit outside of the womb obviously get affected by the fluxes in our hormones each month, just like their lining in the womb does. So it sort of grows in the beginning part of your cycle and then sheds during the time that you're bleeding. So we know that the hormones in our bodies are having an effect on that tissue and can aggravate the tissue and cause pain and discomfort. When we have areas of fat in our body, fat doesn't just sit there doing nothing. It's actually quite metabolically active. And one of the things it does is it makes some of the sex hormones like estrogen. And estrogen has an effect on the tissue. So by having more fat mass in the body, this can cause a disruption to your normal hormonal balance, which could potentially extenuate the effects that you're getting of pain and discomfort during certain times of your cycle. So one of the benefits we know is by losing weight, it helps to improve the hormonal cycling, which again can have an effect on reducing some of the pain and discomfort of endometriosis. We also know that, again, that fat tissue, not only does it create hormones, but it also can release inflammatory chemicals in the body. So that's how part of the process of how we start to develop some of the risks to health when we're overweight or obese for a long time, because that level of inflammation starts to have an effect on the organs of our body. So that's that, again, when we're coming back to heart health, it has an effect on the heart, but it can have an effect on this type of tissue as well, again extenuating the pain and discomfort you get with having this condition. So we know that by, again, losing weight, it helps to dampen down some of those levels of inflammation, which may in itself help to, again, improve the symptoms of suffering with endometriosis. And, alongside what we know in terms of helping to improve the symptoms and what you're experiencing is that we know that endometriosis can have an effect on fertility, which we've mentioned, which obviously, if you're planning a family, could be something that's causing you a bit of, a disruption and it can be causing you significant distress. So again, by losing weight, it might help reduce your symptoms that you're experiencing, but we also know that reducing your weight and reducing your BMI can also help improve fertility. And we know that if you are seeking fertility treatment, sometimes losing weight is part of what you need to do to make that treatment a success. So there are several reasons why, if you're suffering with endometriosis, it might be a good idea to consider looking into reducing your weight. And absolutely looking at ways that you can do that. Now, obviously, when we come onto these lives, we've talked a lot about medication and medication options for helping to support you losing weight. So there are ways that these medications can absolutely help you achieve that goal. Obviously, we've talked about this in previous lives, but weight loss medications and the ones that we hear a lot in the media, Wegovy, Mounjaro, what they do is they help you to control your appetite. They reduce your appetite. They improve how full you feel when you're eating, so you feel satisfied and full sooner. So therefore, they help you to manage the dietary part of losing weight, so helping you reduce that daily calorie intake and stay and stick to that weight loss plan, we all know what it's like when you start a diet. The first thing that happens when we start a diet is that all of a sudden all we think about is what we're going to eat, what we're going to eat next. Then almost you make yourself feel more hungry. So, you know, by taking these medications, it's just that little bit of an extra help, that little bit of an extra support to stick to the dietary plan. So again, it's a great time if you are suffering with endometriosis to have a think about taking action to lose weight for all of those benefits. And again, please do have a look at that blog on our website, because again, there's some great information there.